My guest this morning is Dr. Juan Carlos Alejos from UCLA Medical Center, and our guest is here on Tuned In on Go Country 105, KJZ 88.1, and K-Mozart 1260. Our topic this morning is pulmonary hypertension, and we are discussing that because November is Pulmonary Hypertension Awareness Month. Doctor, now, obviously, the way you're describing these medications, there has to be a certain amount of clinical trials that goes into any medication. Is it tough to find, especially among children, willing participants?
No, I think it's interesting. I find that the pulmonary hypertension patients with that and the families with that are very well educated and very eager. I mean, it's a devastating disease and nearly, across the board fatal without any intervention. I think our experiences have led us to show that, there are options. These medications are not cures. They don't fix the pulmonary hypertension, but what it does is keep the disease from progressing, keep it from getting worse, and keep improve their quality of life. And I think when the patients see those benefits, it's a very small and a very well-informed community. They tend to, seek each other out on whether it's on the internet, in support groups, through PHAs, but they're all very eager to help do anything they can to help find improvements in the not only in the cure or in the treatment, but potentials for cure for pulmonary hypertension.
Well, obviously, the work is ongoing. There have to be tips, though, for people who have PH, things for them to avoid. What would some of the things be that people with PH should avoid?
People with PH, they definitely should avoid, things like smoke, like cigarette smoke. They definitely should avoid going to high altitude. Even flying can be more than the patient with PH can tolerate.
Wow.
So being at altitude, going to the mountains is definitely something that really puts wear and tear on their heart. I think doing exercises that are vigorous exercises is also a problem. Most cases they're limited; they can't do it. But even trying to do weightlifting or trying to run the distances, it is very taxing on the heart.
Making lifestyle changes, does nutrition play into this as well?
As a cardiologist, I have to say nutrition plays into everything. It really, I think eating a heart healthy diet and basically using being smart about your cholesterol and about the amount of salt. Your heart. The big key in this thing, even though it is a pulmonary hypertension, the big key in determining how you're going to do is how your right side of your heart tolerates it. So anything you do that taxes the right side of your heart, for instance, eating too much salt and being kind of fluid overloaded, retaining water, those things make your heart work much harder than they have to. And as a result, that makes your condition overall much worse.
Is there any work that can be done to the heart? Again, as you say, a heart-healthy diet obviously is important, but, and I'm just throwing out the idea, is there any sort of thing surgery-wise that can be done for someone's heart that could improve matters?
Unfortunately, really, the only thing that's really an option surgically to treat pulmonary hypertension eventually ends up being a lung transplantation.
Oh, okay.
So there's nothing, that we can do to, we basically, what we do is try to make the lungs more, give them the ability to relax more so that it makes it easier for the right heart to work. So we take care of, as best we can, of the right side of the heart by allowing it to basically get those blood vessels to relax and kind of dilate up so that it's as if you're, for people living here in LA, I can understand this. It's as if you add an extra 3 or 4 lanes onto the freeway.
Right.
You make it easier for that right ventricle, for that pump, to send more blood forward, and that is probably the best thing you can do long term.
There's probably a fine line there, as you talked about not having too much physical activity, but obviously everyone's trying to be healthy these days. is there a fine line, or is that going to vary patient to patient about how much
I think
exercise
it varies
can do?
patient. I always encourage them to do exercise. I mean, I don't want them doing, weightlifting and bodybuilding or things like that, or trying to play football or play competitive sports. But I do encourage them to walk. I encourage them to, bicycle if they can, and swim. And again, it depends on patient to patient as to how much they're able to do. But I encourage them because, if anything, if nothing else, exercise, one, it does strengthen the heart, and two, it also, by exercising, it does tell us, how they're doing. Because if their level of exercise changes from 1 month to the next, it really kind of is important for us to know if it can give us an impact on what the prognosis for this kind of condition will be.
My guest is Dr. Juan Carlos Alejos at UCLA Medical Center. Our topic this morning is pulmonary hypertension. The program is tuned in on Go Country 105, KJazz 88.1, and K Mozart 1260. Doctor, obviously, a diagnosis like this of PH has to have some emotional impact on not only the person who has received the diagnosis, but their families as well. Tell me about support and things that can be done emotionally for not only the person who's coping with PH, but for their families as well.
I think PHA, the Pulmonary Hypertension Association, is probably one of the greatest assets to them. I think it's something that is rather new in an evolution as this disease is becoming more recognized. And I think peer support groups, the only people who can really empathize with those who have this are those who actually also have family members affected by it. Even little things because some of the medications are given intravenously, which means these patients have permanent indwelling IV lines that they have to carry a backpack around with the medication attached and be changing the medication every day. And this can be like a 3-year-old. So if you can imagine a 3-year-old who wants to run and walk around, but they're now kind of tethered to this medication, how the parents deal with it, it can be very difficult. Sometimes they're dealing with the IV medication, the oxygen, a bunch of different things. And I think that for them to have other families that are similarly affected can be, a wonderful resource for them. And also, seeing, in this group, not only do they get to basically use each other as support, but if they, run into somebody or somebody there is there who is doing well, or improving on their medication, that can act as kind of an inspiration and a positive reinforcement for these patients that are being treated for PH, because just to see that the medication can work, and to see that people out there can live a productive lifestyle, I think is a very positive thing.
Now, I understand that the Pulmonary Hypertension Association has started a new initiative for earlier diagnosis of PH. Explain to everybody why early diagnosis is so important.
I think, the longer it takes you to diagnose the PH, the more affected your heart becomes, which means that the road back to having a meaningful lifestyle is much more difficult. So the earlier that it's noticed, the earlier you can start on treatment regimens that can potentially give you a longer period of having a good quality of life, a longer period of what I could call a plateau where the disease does not progress. I think it bodes better for kind of a more meaningful life survival. Not necessarily, long term. I'm not talking about 50, 60 years, but at least, in the past, people used to use 3 years as a number. With early intervention, I think we're looking at 10, 20 years during which we can treat. And I think there's a lot of research going on right now which can lead to more improvements. So overall, the earlier you get in, the better your prognosis is.
And dealing as you do with children there at UCLA, I would imagine it would be beneficial if you have someone, maybe a young adult or a teenager who may have, coped with the disease for a number of years, to come in and talk to new patients once in a while to give them inspiration to say, hey, look, this isn't easy, but you're going to get through this because I am.
No, absolutely, and to their families as well. I think for the parents who realize they're doing all this work and they don't know what kind of quality of life their child has, I think for them to see young adults who can work, who can have kind of a good daily lifestyle, I think is encouragement for them to continue putting in all the hard work that they're doing.
Now, you mentioned earlier about sickle cell anemia. Now, how often do people with sickle cell anemia develop PH?
It's fairly rare,
Mm-hmm.
but it is a risk, and it's something that needs to be. It's one of the reasons, obviously, that patients with sickle cell anemia need to be followed. Closely, because there are risks such as pulmonary hypertension, that are things that can develop if left, kind of unobserved. So, again, I don't have an exact number, but it is something that really needs to be closely followed in the patient population.
When you have a child who comes in and you have to sit with them and sit with their parents and explain you have pulmonary hypertension, do most parents who are there with their child to hear this diagnosis know what pulmonary hypertension is?
No, I think it's a very difficult concept to kind of understand. Until you sit down and can kind of diagram it out with people, explaining to them about systemic hypertension and what that means. I think it's very often confused with high blood pressure in the body, and so I think it's something that, I think people have a hard time understanding what impact it has on the body and on the heart.
My guest is Juan Carlos Alejos, MD at UCLA Medical Center. We're speaking about pulmonary hypertension. This is Tuned In on Go Country 105, KJazz 88.1, and KMozart 1260. Doctor, we're just about out of time, but just one more question for you. When you see the children that you see every day at UCLA who are fighting the disease and are being valiant, tell me about your personal the impact it's made on you personally, as not only as a physician but as a human being. What does that do for you?
Any of these kids, pulmonary hypertension, or any of the other kids who come in, I see. They're an inspiration to me, and to. I'm glad that we have the opportunity here in this country to use these medications. Because these are medications that are being made for a relatively small part of the population, but still available. Without them, most of these patients would not be alive, today. And I think to see how brave they are and continuing to kind of lead their life forward, and also to see the patients and the parents who are willing to do what they can to help educate and help the other patients, who face with a diagnosis, is really, an inspiration to us. Who really, we don't have, we know how difficult it is for them, but they're the ones who go through it day in and day out. And it's gratifying to see the kids go to school. It's gratifying to hear that they're playing at recess. So, it makes us really kind of want to continue doing what we do.
Doctor, thank you very much for all your hard work. And obviously, what we're doing here is we're trying to get the word out about what pH is for folks who may not know. So the website where people can find out more directly about you is uclahealth.org, uclahealth.org, and people can find out more, obviously, about pulmonary hypertension there as well.
Correct.
Dr. Juan Carlos Alejos, thank you very much for being with us on this Sunday morning.
Thank you. It's my pleasure.
And that's going to do it for this week's edition of Tuned In. We'll see you again here next Sunday morning at 5:30 here on Go Country 105, KJazz 88.1, and KMozart 1260. Have a great week. Thanks for waking up early with us. And don't forget to stay tuned in.
To contact us at Tuned In, email tunedinmj@gmail.com. That's tunedinmj@gmail.com. Or write Mike Johnson, Tuned In, 1288 North Bellflower Boulevard, Long Beach, California, 90815. And please join us again next week for another edition of Tuned In.